So, what's all the buzz about GLP-1 medications? Well, I'm here to explain and tell you the facts about who should take them and why, and how best to lose weight while you're on these. So, women over 40, we know it's really hard to lose weight. You're stuck, you feel in a rut. Well, this might be an option for you. So let's just dive right in. So, who am I? I'm Dr. Diana Hoppe. I'm founder of Amazing Over 40. I'm a board certified OBGYN with over 30 years of clinical experience. I've also helped a lot of women lose weight and manage their hormones. So, balancing hormones can also be part of the equation to help with weight loss. I also focus on perimenopause and menopause, and that is my niche. And I love helping women go through this time of life and be their best version of themselves. So let's just hop right into what we're talking about. So, GLP-1 are medications that help you lose weight, right? Well, I want to make sure that I tested out this medication before I actually, before I actually start telling my patients about it, because I always want to make sure that what I practice, what I preach, and make sure that these are effective and safe, used in the right patient. So this is me, you can see to the left before, and this is after. To the right is after 3 months with the GLP medication. And I used Tirzepatide, which is one of the options, and I lost 18 pounds in 3 months. So you can see the transformation in me, and I'd love to help you with your transformation. So let's talk about, again, what are GLP-1 medications? There's a lot of myths about them and surrounding them. Well, basically, it stands for glucagon-like peptide 1 receptor agonist. Long term, that's why they make it GLP-1. Well, basically, they mimic a natural hormone called glucagon like peptide, and that helps to regulate appetite and blood sugar and also slows digestion. Initially, these medications were originally for type 2 diabetes, but now they have approval for weight loss. And some of the examples, if you've heard them on TV, I'm sure you've seen the ads, etc., about Ozempic, Wegovy, Mounjaro. So those are the actual brand names, but the actual name generic is Semaglutide, and then there's Tirzepatide. So these initially, as I said, were based on treatment for diabetes. So they were actually constructed and developed for type 2 diabetes. And you can see they've been out for about 20 years. In 2005, you can see the first medication that was approved for diabetes. Then as time went on in 2014 to 2021, newer versions came out for weight loss. And then in 2021, Wegovy was the first medication, which is semaglutide, approved for obesity. And now we've expanded to many other medications like Tirzepatide and Zepbound, which is now approved for weight loss. So these are not necessarily new medications. They've been in the pipeline for over 20 years, and they have actually been approved starting in 2005. So, what are the pros? Like, what are the good things about GLP-1 medications? Well, it's shown to have significant weight loss. Depending on which medication you're on, it can vary between 15 to 22%. There can be potential cardiovascular benefits because you're actually losing weight. And if you follow some of the lifestyle tips, you're going to eat better and you're going to lose fat. And that's all helpful for cardiovascular benefits. You're going to reduce your food cravings and actually want less sugar, and you want more healthy foods. It also, obviously, with type 2 diabetes, it improves blood sugar control. It also works on slowing down the digestion, so you feel full longer. And it's basically dosed in a weekly dosing, and that's the subcutaneous injections. So, what are some of the side effects? So, some of the side effects are there's nausea, vomiting, and constipation. So it's really important to drink lots and lots of fluids, have enough fiber in your diet so you don't become constipated. As I mentioned, these medications will slow down your GI tract. That means it will slow metabolism in the peristalsis, we call it, in the GI tract. So it's slower time to move through your stomach and your intestines, and thus you feel fuller for longer. Now, you can lose a lot of muscle mass, so you can lose weight, right? But when we want to lose weight, we want to lose fat. We don't want to lose muscle. So it's really important that you work with a physician and maybe a trainer so that you actually do weight bearing exercise and muscle building exercises, because you do not want to lose muscle. You want to lose fat. Also, there's a risk for gallbladder disease. Certain patients, again, be under a doctor's care so that you can monitor that. They're not cheap. Now, if your insurance will cover it, that's great. But normally for weight loss, it can be expensive and it's out of pocket. And there's also a black box warning for a thyroid tumor risk, and that's in animals. So you do have to consult with your physician to make sure you can take this medication. So who are the people that should not take this medication? Absolutely contraindicated, and if you had a history of medullary thyroid cancer, or men too. So if you do have a history of that, you're not going to be a candidate for these medications. If you also have something called gastroparesis, which is you have a very slow GI metabolism and GI peristalsis, you're not going to be a candidate for this, because this will only exacerbate those symptoms. It's going to make your bowel even go slower. So we don't want to have chronic constipation or severe GI disorders with this medication. Also, if you have a history of eating disorders, maybe like dysmorphia or anorexia, etc., these medications are not for you, in that this medication helps to suppress the amount of cravings, etc., but that we still need to eat when you're on this medication, and you still need to drink lots of water, and you also still need to exercise. So if you have an eating disorder, this medication is not going to be for you. Also, if you're pregnant or planning pregnancy, this is not yet approved or been studied adequately in pregnancy. So again, if you're pregnant or planning to become pregnant, I would not go on this medication. And also if you have severe kidney or liver disease. So again, consult with a physician or your provider who will really be able to see, are you a candidate for this medication or not? And then treat you safely with it. So what specifically do we need to monitor if you're on these medications, these GLP-1 receptor agonists? Basically, you want to monitor different parts of the body, specifically kidney function. So we want to make sure that your kidneys are excreting what we need to excrete and you have normal kidney function. And that is, your doctor will do something called the BUN creatinine on your labs. Now, also very important is to monitor your muscle mass. We want to gain muscle and we want to lose fat. Again, I cannot stress that enough. Some people lose weight, but it's all muscle. We don't want to lose muscle, especially after 40. We want to increase that metabolic rate so that you burn more calories, and then you can keep that weight off. So it's really important to work with a trainer or a buddy that you will go to the gym, do the weights, do cardio also, but make sure you're doing weights so that you can keep your muscle mass nice and high and maybe even improve your muscle mass. We want to lose fat, specifically that visceral fat, which is the abdominal fat near our intestines, in our peritoneal cavity. So inside of us, in our cavity here, it's called a peritoneal cavity. Basically, that's where your organs are, your liver, your intestines, etc. But you also have a lot of fat tissue there, and that's something called the omentum. And then that will, if you lose fat, we want to lose visceral fat. Okay. So we also want to make sure you stay hydrated. So drink at least half your body weight in ounces of water. If you're also exercising, you're going to need more. So let's say you're 140 pounds, you want to drink at least 70 ounces of water per day. And also important is put electrolytes in that water, because if you're sweating, you're going to be losing salt, which is sodium chloride. So make sure you add electrolytes to your water. And also, you want to monitor mental health. Sometimes there can be some depression with these medications, some mood swings, and maybe some headache. So you really want to make sure that you monitor those symptoms also. So patient education tips. What are things you can do to help if you're on this medication and you're trying to lose that fat and gain a muscle? We want to eat slowly to avoid GI distress. So you're going to need to still eat if you're on these medications. So you're going to have smaller meals, but you still need to have like 5 meals a day. You want to avoid large, high-fat meals. We want really nutrient-dense food, and we really want to prioritize protein. So in general, it's recommended about 30 grams of protein 5 times a day. or let's say at least 20 grams 5 times a day. So that's 100 grams to 150 grams per day. So you really want to increase that protein intake, again, to keep that muscle mass as high as possible. You also want to stay active. You want to exercise. Why? That'll keep your bowel moving. That helps with the GI tract. It helps things move, we call peristalsis, gets your bowel going so that it keeps moving so you don't become constipated. So again, doing the weights, staying active, walking, cardio, very important. And then also plan for long-term maintenance. This is a medication that may be used for a long period of time. It may be that your maintenance is once a month, but in order to keep that weight off after you've worked so hard to lose it, we want to maintain it. And that means keep doing those lifestyle things like prioritizing protein, exercising, doing the weight bearing exercises, and then muscle building exercises. So these are things, it's not just a once and done type situation. It is a mindset and a lifestyle change. So what's in the pipeline? I just want to just show you 2 medications that will be coming out probably later this year. I'm not even going to try to pronounce this one. This is going to be FDA approved in 2025. This is a once daily pill. So what I've been talking about are the weekly injections. This will be a once daily pill, and this should come out in the late part of this year. And then this is another medication that is a combination of semaglutide with an amylin type protein, which also helps with weight loss. This is a once weekly injection, and it looks like it's probably going to be approved, or at least a file for FDA approval in 2026. So what are some final thoughts? I think for certain patients, these medications can be very powerful, especially if it makes that patient have lifestyle changes, eats better, focuses on protein, drinks enough water, and also has the muscle building ability. It's really important to work with a medical professional who knows these medications and knows what to watch out for, and make sure that you're safe and effective while you're on this medication. We don't want you to have any potential side effects that might be very harmful. So again, really have a provider who is well versed in these medications so they can really help you lose that weight and maintain that weight loss. And it's important to have a personalized treatment approach. And that's what I do with my telemedicine. I really try to individualize treatment. I make the best kind of program for you, because as you lose the weight, we want to make sure you hold on to that muscle, and we want to make sure that long term you're maintaining that weight loss. So with that, I hope I clarified a lot of the different myths about the GLP-1 agonist medications out there. And if you do want to contact me, please feel free to call me, go to my website. As I mentioned, I'm the founder of Amazing Over 40, and I'm also offering right now a free 15-minute discovery call. So if you want to scan this to book an appointment, go to the calendar, book a call, and then we can get you started on losing your weight and feeling the best version of yourself. So here's to everyone feeling amazing.